with our very first presenter. Kaley Donaldson will be presenting on prevalence and impact of diaper need in Erie County, New York. Kaley?
Thank you, Laura. Hello, everybody. My name is Kaley. I am a Master's of Public Administration student at Buffalo State, and as part of my capstone research, I looked into the prevalence and impacts of diaper need in Erie County, New York. So what is diaper need and kind of why does it matter? Diaper need is when parents cannot afford to provide an adequate supply of diapers to keep their children comfortable and clean and dry, or when they have to cut back on basic expenses, food, utilities, rent, that kind of thing in order to provide an adequate supply of diapers. Historically, diaper need is a relatively under-researched topic. There's only ever been one national study conducted into it, and that was conducted by Huggies in 2011. So from the limited information that we have from a national perspective, we know that 1 in 3 mothers suffer from diaper need. And with the exception of TANF, there are really no federal or state safety net programs that allow for the purchase of diapers. So in looking at my study, I distributed a study in conjunction with 3 area nonprofits in Erie County. All of those nonprofits serve families with young children, and those nonprofits identified that diaper need was an issue that their clients faced, and they were taking measures to kind of mitigate that need for their clients. The survey was designed to measure attitudes towards diapering, prevalence of diaper need mitigation efforts, as well as awareness and utilization of the local diaper bank. And from the respondents, we were pretty well represented from an income perspective. We had participants that made less than $20,000 annually and participants that brought home more than $100,000 annually. So what that kind of showed us is that diaper need is not solely a low income family issue. If you look at the crosstab on the bottom here, even families that we would consider more moderate income, those making $50,000 to $75,000 a year, are still reporting diaper need at just over a rate of 50%, which is an increase from what we know from the national statistics. Additionally, about half of respondents indicated that they were paying $20 or more a week for diapers. And when you break that out, that's about $87 a month, just over $1,000 a year. So if you think that's just for one child in diapers, if you have 2 or 3 children that are all potentially wearing diapers, that's a lot of money to shell out as part of a weekly budget. Additionally, respondents indicated that in an effort to mitigate mitigate diaper need, they were keeping their children out of childcare, reducing spending on diaper-related items, increasing time between diaper changes. Additionally, parents reported that they were underpaying or skipping payment on utilities and rent. Some parents even indicated that they attempted to wash and reuse soiled disposable diapers because they just didn't have enough to make ends meet. Where this particularly becomes a problem and takes it out of a family issue and turns it into a community issue is where parents are keeping their children out of childcare. If you think about it from an economic perspective, I have to bring diapers to childcare for my child to go. If I can't afford clean diapers, I cannot drop off my child, which means that I don't get to go to work and my workplace suffers economic consequences because of that. Additionally, for the low-income parents who may be taking advantage of the subsidy system, if they're not dropping their child off at childcare, their child or care provider isn't being paid for that day, which then affects the bottom line of that child care provider. So there's a ripple effect to diaper need that goes beyond the family. So I proposed several local, state, and federal policy tweaks and changes that could help mitigate this for families. So from a local level, diapers are considered a tax-exempt clothing item at the state level. However, under that tax bulletin, counties are still allowed to collect sales tax. So this is a particular burden for those who may not have access to or be able to afford diapers in bulk. If I don't have transportation and can't get to a BJ's or a Costco and can't buy diapers in bulk, I'm paying more sales tax during the year than I would be if I could buy them in larger quantities. So a small tweak to this tax code by eliminating this regressive local sales tax would help families while also minimally impacting local budgets. From a state level, this is probably the most cumbersome change, I would say, but also has the potential for the biggest long-term return on investment. I'm proposing that we add a diaper stipend of about $15 a week, which is just under what parents are saying that they're paying a week for diapers, or $3 a day for providers claiming a daily rate, and attach it to childcare subsidies so that childcare providers can provide diapers while children are in care. So if you think about this program, it would work similarly to how free and reduced lunch works in our K through 12 school districts. You know, families demonstrate need, and then lunch or breakfast or both are provided to those children while they are at school. This would be a similar process. Families would access childcare subsidy through their local Office of Department of Social Services. Once they're able to demonstrate their need and sign up on that level, then this diaper stipend would be provided to childcare providers directly. Providers could then buy diapers in bulk, reducing the cost a little bit of what they're providing. And it reduces parental stress by eliminating the burden of purchasing and transporting diapers for their children while in program. But additionally, this relieves a barrier that low-income and moderate-income families have in accessing high-quality childcare. So we know that 90% of a child's brain is developed before they're 5. So these high-quality early care and learning experiences are essential to their development. Those that receive high-quality care are more likely to graduate high school, more likely to graduate college, less likely to need public assistance later in life, less likely to receive a special education placement, and less likely to be held back a grade. So by removing this this barrier, which is diapers, because they are already provided in care, we're giving families a greater chance to access these services that will long-term support not only that family, but the community as a whole. This has been recognized slightly at a federal level, and early Head Start and Head Start providers are also required to provide diapers while children are in care, because the Head Start program has recognized that providing diapers is sometimes a barrier to care for families. At the federal level, there's a couple things that we can do. The first one is really aimed at our middle income families. So making diapers an HSA eligible product. Currently, diapers are not. Adult diapers are, diaper rash cream is, and older children, overnight pull-ups are available under certain circumstances. So by making diapers an HSA eligible item, we're really helping families who may not suffer from diaper need every single week, but suffer from it when unexpected expenses arise. So, medical bill, car trouble, house problem, whatever it may be, having this kind of safety net, this fallback plan for parents through HSA would really kind of help them out. Additionally, the other change would be to allow for the purchase of diapers with SNAP or WIC funds, which could reduce some of the preventable Medicaid spending. So increasing the time between diaper changes often leads to preventable medical issues such as diaper rash or UTIs, which those that are taking advantage of SNAP or WIC are also often taking advantage of the Medicaid system. So by reducing the likelihood that they're going to need their children are going to experience a preventable diaper-related illness, we can reduce unnecessary Medicaid spending in that way. ultimately, diaper need really isn't just a low-income family issue. It's an every family issue, which also makes it a community issue. It has long-lasting ripple effects, not only on the community, but on the local economy. And through some simple changes, we can really help mitigate diaper need. Thank you.
Wow, excellent presentation, Kaley. I really appreciated hearing, this is Melody Baker. I really appreciated hearing all the details that you had about potential policy changes and opportunities for children to have greater access to childcare, given the need of having access to more diapers. So I really appreciate that. As a mother of 5, I completely remember the challenges associated with just like, if you forgot to pick up diapers, you're kind of like, up the creek without a paddle. So my question is, you did a really good job of talking about that this does not just affect low-income families, but it also affects middle-income families and lower middle-income families. Characteristically, can you provide any other information or details about the populations that this affect? In other words, do you see any higher instances of this affecting maybe immigrants, historically underserved populations? Are there any implications for other groups that we don't know of, but mainly, which groups, if any, are more affected than others?
Sure. So unfortunately, in my research, I had a high non-response rate when it came to racial and ethnic questions. So I can't answer that section of it. I can tell you that I did have parents or caregivers respond as far as like marital status, and that single parents were more likely to be experiencing this than those living in a domestic partnership or being married. And of those that reported in my survey, as far as demographics were concerned, I had most of the survey respondents were working parents or students, but it was mostly working families that were struggling with this. And it wasn't so much the student population didn't necessarily have the same response rate of claiming diaper need. And I think part of that is there's been efforts on local campuses and through community organizations and, kind of more grassroots efforts, especially in Buffalo proper, that sort of help mitigate diaper need a little bit. So that would kind of be what I would attribute that to, but it is really a single parent and a working parent issue primarily.
Wonderful, thank you.
Yep.
Jeff, do you have a question?
Yes, thank you. Kaley, it's Jeff Cheek. So I appreciate that you delineated what policy changes would be more effective at both the local, state, and at the federal level. With respect to any or all of those, any ideas about what you mentioned, also the return on investment, the ROI? How would you assess whether or not the policies that you're suggesting would be effective? Are there any kind of qualitative metrics that you think we could start to look at to see if it's truly being successful, and therefore have that be like a feedback loop to reinforce why we need to increase or keep doing this or change course if we need to?
Yeah, so I think obviously, I think the easiest one to track would be that state level policy change as far as, who's taking advantage of it and at what prevalence it's being taken advantage of. Because you could, through the subsidy system, track who was getting that diaper stipend. That being said, the sales tax, kind of hard to track without doing additional surveying in the future. But SNAP and WIC funds also, you could do monitoring through looking at what people purchased and in what percentages people were kind of taking advantage of diapers as an eligible item for those kinds of things.
Thank you.
Mm-hmm.